No need to rush for masks. Mpox is not the new COVID-19. There is no need for panic buying, especially masks, as mpox is not spread through droplets produced when an infected person coughs or sneezes, said infectious disease experts. This was after the World Health Organization, WHO, Regional Director for Europe, Dr. Hans Kluge, said at a media briefing on the 20th of August in Berlin that the mpox virus, regardless of whether it is the new or old strain, is not the new COVID-19. As the authorities know how to control its spread. Professor Teo Yik Ying, Vice President for Global Health and Dean of the PHEIC School of Public Health at the National University of Singapore, told the Straits Times that mpox spreads predominantly through close contact. This means the way we protect ourselves must also take into account the way mpox spreads. For example, mpox can spread through direct contact with the skin lesions or bodily fluids of an infected person, so avoid close contact with individuals who have symptoms, he said. Professor Paul Tambier, president of the International Society for Infectious Diseases, said, unlike other recent public health emergencies, we have highly effective vaccines that can not only prevent infection, they also prevent transmission. As such, if we are infected, we can notify our contacts so that they can receive post-exposure vaccination. This is a highly effective strategy and worked in controlling the outbreaks of 2022 to 2023 in Europe and North America, but sadly there was no access to the vaccines in Africa, which contributed to this second declaration. He added, the disease has never been documented to be spread by the respiratory route, although it is thought to have contributed to 1 or 2 cases, so there is no need to return to mask wearing at all. WHO declared mpox a global public health emergency on the 14th of August, the second time in 2 years. There have been 27,000 cases and more than 1,100 deaths, largely among children, since January 2023, in the current outbreak in the Democratic Republic of Congo, DRC. WHO Director General Tedros Adhanom Ghebreyesus said the emergence of a new clade of mpox, its rapid spread in eastern DRC, and many cases in several neighboring countries are very worrying. Reiterating Dr. Tedros' sentiments, Health Minister Ong Ye Kung said on the 17th of August that the mpox outbreak in Africa and other places is very worrying as the virus is expected to spread to the Middle East and Europe, which Singapore has flight connections to. We should be on alert. We should expect it to arrive in Singapore, and then when it does, respond appropriately and effectively, Mr. Ong said. Singapore has had 12 cases of mpox since January 2024, which the Ministry of Health confirmed were all from the milder form of the virus, known as clade 2.
If you enjoy our insights, please consider subscribing to help us bring more content like this. Thank you for tuning in. Clicking the subscribe button is a great motivation for the channel. Thank you very much.